You're watching the news for South Mississippi. This is the 4 o'clock show.
And welcome back. Mississippi is one of 15 states that received a $1 million certified community behavioral health clinic planning grant designed to help transform mental health and substance abuse treatment. And joining us now, Mississippi Department of Health Executive Director Wendy Bailey to explain what the next steps are in South Mississippi. Wendy, thank you so much for joining us today. And of course, this is really a big step, and I know something that could make a difference, and it's really just the beginning, but you hope that it's going to carry over into following years too to come.
That's exactly right. This is actually a 12-month planning grant, and over the course of those 12 months we will be developing the criteria and the payment model for the system of certified community behavioral health clinics. So truly, it's going to transform the way that mental health services are provided by our community mental health centers.
Yeah, and this is so important because too many times, I know you see this time and time again, people often don't seek mental health care because of the cost and other factors, and this could go a long way toward helping with that as well.
That is correct. So this program, this model, a CCBHC, it has 3 components to it. CCBHCs are required to serve anyone who needs mental health or substance use care regardless of their ability to pay. They are required to get people into care quickly and to provide crisis services 24/7. And they must provide care coordination to help people navigate the behavioral health care, physical health care, social services. It truly wraps services around people.
Yeah, and this is something that hopefully will be sustainable for community services.
That is correct. One of the ways that it's sustainable is it changes the reimbursement system. So we will be partnering very close with the Division of Medicaid and the community mental health centers across the state over the next year for this system.
Now, I also saw something about creating more competitive wages too to help with the job shortage. Is that a part of this as well?
That is correct. States that have implemented CCBHC already, some of the positive outcomes have also been that they have seen an increase in hiring and retention. So it is a way that it can help address the workforce shortage in our state. We've seen that in other states that have already implemented it.
And Wendy, just how serious do you think the problem is of people not seeking mental health care for mental health, whether it's related to substance abuse or not?
I think it's a significant problem. I think stigma is one of the top reasons people do not seek help. They're embarrassed or ashamed, or they don't know how to seek help. And what we want people to understand is that hope is available, that recovery is possible. And there are so many people across our state that are positive stories that show you that recovery is possible and hope is there, and you can reach out and get those services.
All right, Wendy. Well, this grant is definitely a big thing and certainly encouraging. Thank you so much, Wendy Bailey, for joining us from the Mississippi Department of Mental Health today.
Thank you for having me.